My name is Marlene Hodges. I'm an HIT advisor at Telligent, and we are working with IDPA, or Iowa Department of Human Services, on a program that is bringing some technical assistance and education to dentists in Iowa in regard to EHR selection and implementation, and then further working with folks, dentists that are hoping and attempting to achieve meaningful use with their EHR systems. And we're glad to bring this program to you and these services to the dentists in Iowa. So thank you for your participation today, and we'll go ahead and get started. Today we're, as you know, focusing on the selection and implementation process, and we've got a lot of information to share, so we're going to just jump right into it. EHRs, let's talk a moment about the benefits of EHRs in our current digital world. First, just to kind of set the context a little bit, let's talk on this slide in terms of the definition of an electronic dental record, EDR. So the American Dental Association defines the EDR as an electronic health record. It is a combination of processes and data structures used by dentists for purposes of documenting or conveying clinical facts, diagnoses, treatment plans, and the services provided. For this particular presentation and going forward and just in general, we do refer to the electronic health record, the EHR, in terms of the EDR as well. We refer to it generally as an EHR. It's a little bit more of a global term. So it will be referred to as an EHR through this particular presentation, though of course some particular electronic health records are specifically as electronic dental records. So you'll be familiar with those terms. Our world, as we all know, has been radically transformed by digital technology. Between smartphones, tablets, web-enabled devices, they've all transformed our daily lives in the way that we communicate. Medicine and all of its specialties is an information-rich enterprise. So much information collected out there by all the different facets of medicine. So digitally speaking, it's amazing all the information that is captured and that can be utilized in so many different ways. A greater and more seamless flow of information within a digital healthcare infrastructure, which is created by the EHRs, encompasses and leverages digital progress and can transform the way care is delivered and compensated. And with the EHRs, information is available whenever and wherever it is needed. At a high level, the benefits of EHRs, there are many, but at a very high level, we're looking at improved patient care, practice efficiencies and cost savings, improved care coordination, an increase in patient participation, and improved diagnostics and patient outcomes. In terms of providers and patients both, it's a win-win. Providers with busy practices and patients with busy lives appreciate the convenience in their healthcare transactions, and EHRs can help achieve this. Providers can typically access patient files or submit prescriptions remotely from home or while on vacation if necessary. With more complete patient information, providers improve their ability to make well-informed treatment decisions quickly and safely. In terms of improved healthcare quality and convenience for dentists, we're going to look at this briefly on the dentist side as well as the patient side. So it provides quick access to patient records for more coordinated, efficient care, enhanced decision support, clinical alerts, reminders, and medical information, performance improving tools and real-time quality reporting. You have your data at your fingertips, essentially. You can look at different reports, see how you're doing with certain things, look at your performance more readily. Legible, complete documentation that facilitates accurate coding and billing, and safer and more reliable prescribing. In terms of improvement for patients, you're looking at the reduced need to fill out the same forms at office visits. You're looking at reliable point-of-care information and reminders notifying providers of important health interventions. The convenience of e-prescriptions electronically sent to their pharmacies. Patient portals with online interaction with their providers. If your patient would like to request an appointment time, they can do those through their patient portal. If they need to look up for their child when their child's last dental exam was, they can look that up via the patient portal. That's more convenience for your patients, and it's more efficient for your office staff as far as fielding all those types of administrative phone calls. And electronic referrals, allowing easier access to follow-up care with any specialist. Let's talk for a moment about efficiencies and cost savings as they relate to EHRs. So many providers have found that EHRs help improve practice management by increasing efficiencies and cost savings. We've got some data, a national survey of eligible professionals who are ready for meaningful use of their EHRs. They offer some important evidence. As you can see with the statistics here, 79% of providers report that with an EHR, their practice functions more efficiently. 82% of those report that sending prescriptions electronically saves them time. 68% see their EHR as an asset with recruiting staff. So, you know, as new dentists and dental professionals enter the workforce, they tend to gravitate towards practices who may be looking harder or already have those technologies in their offices. They know that they're poised for the future. They know they're looking at technology as a valuable tool for them. And 70% report enhancements in data confidentiality, so some good data there. You may be curious where the ADA is involved in terms of EHR activities, so we wanted to provide some of that information to you today, in case you may not be, in case you are not aware. The ADA has taken a leadership role in defining dental EHR functions and features, capabilities, through its work in the standards arena. The ADA has developed an internationally recognized dental terminology. SNODENT is its short terminology, it's its acronym, and that is for the purpose of a standard terminology for capturing detailed clinical data in a coded, structured manner. So this is the coding that goes on behind the scenes with your EHR, so that things are, so that your EHR is capturing that data in a standard terminology, so that that there can be some interoperability there amongst systems. The ADA has been leading in development of dental information technology standards via its ANSI-accredited Standards Committee for Dental Informatics. So the ADA very, very involved here in this area. So you should feel confident that they're doing a lot of work there. They have been doing a lot of work. They continue to do a lot of work in terms of EHR and standardization. If you're curious about which EHRs are currently in use in our state, this is a very good snapshot of those particular EHRs that we're using. I won't go through each of those individually. You can see those here, but there's some good, in terms of the resources, I've got those listed too, but there was an Iowa, Medicaid, and CMS EHR incentive, the attestations that folks have already submitted to Iowa Medicaid. They have to share what their system is that they're using. So some of the samples came from those. There was also an environmental scan that was done in 2015 where dentists shared which systems they are using in their practices. So this list comes directly from Iowa providers, Iowa dentists, and these are the, a sampling of some that are in use in terms of those who have attested and those who responded to that environmental scan. So wanted to share that information with you. In terms of payment reform, quality over quantity, meaningful use of certified EHRs, the meaningful use program is going to begin folding into the new CMS quality payment program in 2017. What this means is payment incentives and disincentives to Medicare Part B reimbursement will accompany the QPP based on quality of care rather than quantity. The third bullet I want to be sure you can pay a bit of attention to, that while payment adjustments may not have a significant impact to dentists in the immediate future, the pressures will build from other payers to look at quality payment models as well. So in terms of Medicare Part B and those payment incentives and disincentives, those might not affect you very strongly at your practice, but different payers start to look at that. In addition, we've also seen and heard that other providers are going to be, are actually more inclined and hopeful in working with dentists who have adopted EHRs and are on that same quality of care continuum to deliver whole person care to their patients. So you may start hearing from other providers as lots of different specialties and primary cares are now on EHRs that you might get more inquiries from folks as far as, you know, when your practice might be utilizing an EHR where they can have some type of interoperability happening with the dentist as well. The fourth bullet point, dentists will not want to find themselves left behind in the national push towards digital healthcare and financial impact. So, you know, quite a few years back, there, in terms of the primary care folks, there weren't a lot of pressures on them either to really get rolling with EHRs. You had your early adopters out there who have been on EHRs for a very long time, but as the different payment models, as meaningful use rolled out, as incentives became available, as the pressures continued to build, primary care started really going hard with EHRs in years past, and now, you know, it's fairly common. I don't have the current statistic right at my fingertips, but as we all know, as we go into our own primary care providers, EHRs are very prevalent now. So as they roll out to specialists, keep that in mind too as far as your dental practice. I'm sure that's why many of you are on the call today to learn more about how to look at the process of selecting and implementing. So let's jump into the path to implementing an EHR. We've got a very good 6-step process with a lot of details behind each step, but it should give you a good jumping off point, a good guide, a good backbone and framework for your process and your individual practice so that you can feel as though you are following the proper steps that you need to follow to make a good decision and have a good, successful implementation. This lists out the steps 1 through 6, and we'll go through each of these individually. The source for this 6-step process comes through healthit.gov, which is spearheaded by the Office of the National Coordinator for Health IT. The ONC is that particular office for short. They funded for approximately a 5-year period the HIT regional extension centers throughout the United States. Here in Iowa, we had one regional extension center, and that was us here at Telegen. We did that contract of helping providers in the state with meaningful use in selecting EHRs. And what they have done over the course of that whole project on the national level was to put together this 6-step process, this path to implementing an EHR, and they've done a very nice job with that. We'll go through some of that here. So step 1, assess your practice readiness. Looking at your assessment phase. So the assessment phase is foundational to all other implementation steps. It involves determining if your practice is ready to make the change from paper records to electronic health records, or to upgrade your current system to a new certified version. Maybe you've had a system for some time, but it's maybe, or you know that it's not a certified electronic health record. This might be the time to move into a more comprehensive EHR product that has been certified. And we'll talk a little bit more about that here in a few slides. In terms of why to implement an EHR, the assessment phase should address the following question: why? This EHR implementation step should help dental practice leadership evaluate their current state to determine what is working well and what can be improved. So, in terms of the why, let's look at some key questions to consider. Some of the questions dental providers ask themselves during this particular phase include, am I accomplishing what I thought I would be doing when I decided to go to dental school? Are we providing the best possible care to our patients, or are we simply trying to make it through the week? If I had more time, what would I do differently? What would it be like to leave the office yet stay connected to my practice? And am I positioning myself for the national shift to payment for quality and alignment with the National Interoperability Roadmap? These are some things to consider. Key considerations. So at this assessment stage, your dental practice leadership and staff should consider your clinical goals, your needs, your financial readiness, as well as your technical readiness. So, in terms of looking at the current state of your practice, are your administrative processes organized, efficient, and well documented? Are your clinical workflows efficient, clearly mapped out, and understood by all staff? Are data collection and reporting processes well established and documented? And are staff members computer literate and comfortable with information technology? So these are some key questions that you want to be thinking about. In addition, does the practice have access to high-speed internet connectivity? Does the practice have access to the financial capital required to purchase new or additional hardware that will be necessary? Are there clinical priorities or needs that should be addressed? And does the practice have specialty-specific requirements? And in your case, yes. So envision the future. The next EHR implementation step, also within this assessment phase, is to envision the future state of your practice. What would the dental practice leadership like to see different in the future? More specifically, what will be different for the patients? What will be different for the providers? What will be different for staff? Set your goals. Very, very important. Goals and needs should be documented to help guide decision-making throughout the implementation process. You want to set goals in areas that are important and meaningful to your practice. These may be clinical goals, revenue goals, or goals around work environment. Goals in all three areas will help assure balanced processes after the implementation. And goals that are important to you will help you and your staff through the change process. So make this process your own. Make it what you want it to be in terms of the goals that you have for your practice, for dentists individually and staff as well. The SMART goals process. Some of you may have heard of this particular approach before. It's a very nice and easy to follow process that you can just kind of hit the ground running with. So following this SMART goals process, which includes setting objectives and goals that meet the following criteria. So are they specific goals? Achieving the goal would make a difference for our patients and our practice. Are they measurable? We can quantify the current level and the target goal. Are they attainable? Although the goal may be a stretch, we can achieve it. Relevant. This is worth the effort and time that you're putting into it. And time-bound. There are deadlines and opportunities to celebrate success. Set deadlines for yourself as you go through these 6 steps. That'll help keep you on track. That'll help to make sure that things continue to move forward, and it will help to ensure that you don't get kind of project fatigue, that, you know, sometimes these types of things go on and on and on, and then people just kind of lose their momentum with it or lose their interest. So set timelines, then you will know that you are making those, hitting those milestone points, and people will feel like your process is moving forward effectively and efficiently according to your plan. Goals and staff. So goals and needs may need to be reassessed throughout the EHR implementation steps to ensure a smooth transition for the practice and all your staff. These goals become the guideposts for an EHR implementation project, and achieving these goals will motivate dentists and dental staff to make necessary changes and attain new skills. This may be, you know, a whole new thing for most, and so you want to have your goals as those guideposts as you move forward. Looking at critical outcomes in this assessment phase, what you are looking at is a designated leadership team for the EHR implementation process. And so for small practices, it might be everyone. For larger practices, you want to have folks from the people from the different areas of your practice, but not necessarily the entire staff. And having strong and positive advocates for change can be one of the strongest tools to guide the transition. So try your best to have some good leadership here, some folks that are positive and looking to move forward, realistic, and knowledgeable about your practice. Second bullet point, have a unified vision. So where each member of the dental team understands how they will be affected by the change and understands the roadmap to success as well. And again, those measurable, quantifiable, realistic goals, which are the key to the assessment phase. So that leads us to step number 2, planning your approach. So clarify and prioritize. Building an EHR implementation plan is critical for identifying the right tasks to perform, the order of those tasks, and clear communication of tasks to the entire team involved with the change process. So again, this is going to focus on setting your plan. One effective step in the planning process is for the team to segment tasks into 3 categories. So what new work tasks or processes are we going to start doing? What tasks and processes are we going to stop doing? And what work tasks and processes are we going to sustain? So this start, stop, sustain exercise helps to clarify what the new work environment will be like after the change and help the team prioritize tasks in the overall EHR implementation plan. So you might wonder, what are some actual tactical steps that we need to be doing? So this is going to get us into those a little bit more here in terms of your planning phase. So number 1, analyze and map out the practice's current workflow and processes of how the practice currently gets your work done. So what is your current state? Take some time. It shouldn't hopefully be too burdensome, but map out those workflows of what your, as far as your staff and the dentist workflows with the patients, with your front office, with your back office. Get those processes mapped out. Number 2, map out how the EHR will enable desired workflows and processes, creating new workflow patterns to improve inefficiency or duplicative processes that you might have taking place. So what is your future state? What will the EHR help in terms of making those workflows and processes more efficient? Your vendors can help you too as you walk through it. Once you finally do get to that decision-making phase, this comes back into play in terms of the future state and getting the workflows mapped out for when that EHR gets implemented. Number 3 here, create a contingency plan or a backup plan to combat issues that may arise throughout the implementation process. Number 4, create a project plan for transitioning from paper to EHRs and appoint someone to manage that project plan. Establish a chart abstraction plan or a means to convert or transform information from paper charts to electronic charts. You're going to want to identify specific data elements that will need to be entered into the new EHR from your paper charts, and if there are items that will be scanned. So some of those things from your paper, you're going to need to work on what your chart abstraction plan is to get that data into your EHR. And some of that will fall heavily to staff there at your practice, and some of it your vendor of your chosen EHR will be able to help you facilitate as well. Number 6, understand what data elements may be migrated from your old system to your new one, such as patient demographics or provider schedule information. Sometimes being selective with which data or how much data you want to migrate can influence the ease of transition. Typically, what we've heard in the past from folks who have done this transition from paper to electronic is people often make the mistake of trying to migrate too much information from the paper chart. So again, as I mentioned a minute ago, work with your vendor to see what can be migrated most efficiently, and you need to determine what, as staff, what is most essential to get moved and in from the paper charts into the new. Identify concerns and obstacles regarding privacy and security and create a plan to address them. It is essential to emphasize the importance of privacy and security when transitioning to EHRs. Okay, moving into step 3, selecting or upgrading to a certified EHR. Okay, selecting an EHR system is a critical decision and a significant planning task. I think you all probably can have a good grasp of that now. Some practices go through the planning process and develop the selection criteria they wish to use. Other practices begin by selecting an EHR system and then conduct planning to support the selected EHR system. Most practices develop an initial plan to identify their key goals, select an EHR system that supports these goals, and then finalize their plan after the selection. So that last approach there on the slide is your most common, typically your most effective approach, is kind of know what your key pieces are, what you want out of your system, what your goals are, and select one that supports those particular goals. In terms of EHR software comparison, after establishing the dental practice's objectives and planning how the EHR will affect workflows, the leadership team and staff can determine what to look for when considering and selecting your system. So in terms of your software comparison, you may already have an idea, or once you start doing some initial research, talking to some colleagues that you know who already have EHR systems, you may very quickly develop a short list of maybe 4 or 5 EHR vendors and products that you want to take a look at. So you need to kind of have a process, which we're going to map out here in terms of comparing those products. So number 1, understand if and how a vendor's product will accomplish the key goals of your practice. So this is a test drive of your specific needs with the product. You're going to be looking at these products. You'll be scheduling with the vendors, with one of their representatives. You'll be scheduling some time to go ahead and take a look at those products and ask your questions. Have them give you a look at all the different features of those products. That's kind of your test drive. Provide the vendor with patient and office scenarios that they may use to customize their product demonstration. So again, you want to make sure that you're able to see in a product demonstration the proper flow of how, from the time a patient comes into your office for an appointment. You want to see how that would be stepped through in the EHR system, and if that seems to support your workflows and your goals of what you want to do. Number 2, clarify startup pricing before selecting an EHR system. So that's going to take into account hardware, software, maintenance and upgrade costs, option of phased payments, any interfaces that you might need, or any customized quality reports. So these are things, of course, that you're going to want to be clarifying and getting in detail before you actually select your system. Number 3, define implementation support. So how much support are they going to provide? The amount. What is the schedule? Information on the trainers, so who's going to be training you, such as their communication efficiency and their experience with the product and the company. So you'll be assigned folks that are trained to give you implementation support and provide training to you and get the system installed. Get some information about the background and who and how much will be involved there. Number 4, clarify roles, responsibilities, and costs for data migration strategy as desired. Sometimes being selective with which data or how much data to migrate can influence the ease of transition. So we talked about that a minute ago as well. And then server options. So will the system be on a client server or an application service provider, an ASP, or software as a service, the SAS? And your vendors can explain, the vendors that you are looking at can explain the different pros and cons to each of those server options to you as you go through the process, so that you can appropriately decide what's going to work best for your particular practice, in your particular community, and so forth. Number 6, the ability to integrate with other products. So will you need to have it interfaced with practice management software or your billing system? You may choose an EHR system that is a comprehensive system where all of that is built into the same system, and the product has all that available, and so no particular interfaces would be necessary. So again, something to ask about and consider as you are looking at different products and how they may fit your needs. Number 7, privacy and security capabilities and backup planning. Number 8, linking payments and EHR incentive rewards to implementation milestones and performance goals. So in terms of any EHR incentives you're looking at, some folks like to get their vendor also involved in that in terms of making sure that I can get to my reports that will help me to attest to those incentive programs. Sometimes getting the proper reports and meeting those performance goals can be challenging with certain EHRs, and so talking to your vendor about that in advance is an important thing to do. Number 9, vendor stability and or their market presence in your region. So how long has the particular vendor been in business with their EHR or particularly their EDR? And do they have other clients, other dentists in the region here in Iowa, just as you? So get a sense of where most of their clients happen to be. That can be important information as well. Number 10, consider costs of using legal counsel for contract review versus open sources through medical associations if you have those available. Oftentimes, folks will have any legal counsel that they typically use for their practice. Take a look at the contracts of the EHR and just to make sure there are not other things that need to be negotiated with the vendor prior to signing the contract. I wanted to speak for just a moment. You might have about certified EHR systems. You have heard me mention certified a couple of times here today. So I wanted to make sure there was some clarity on that. Certification of an EHR system ensures that the EHR technology providers choose to adopt offers the necessary technological capability, functionality, and security to help them achieve meaningful use. So the concept of the certified EHR systems came about through the program of meaningful use through CMS to make sure that the products could do what was necessary. Eligible healthcare providers must use certified EHR technology to qualify for incentive payments. So they have to be using a system that meets all the criteria that is necessary. There are more than 500 certified complete EHRs or EHR modules, and those are listed on the Certified Health IT Product List. It's referred to as CHAPL, CHPL for short. I provided that the link to go to that particular website, and so you can look at some of those certified systems. If there are systems that you have on your short list that you are looking at, make sure that you go to this CHAPL website to find out if that has been a system that is certified or not. So again, an important thing to keep in mind in terms of the certification. If you have any questions as you move forward about whether the system you're looking at is certified or not, please feel free and get a hold of me, and I can help walk you through the research on that as well. They have updated that particular site recently, and it's pretty user-friendly, and it allows you to do those searches on the products you're looking at. Okay, step number four, conduct training and implement the EHR system. EHR implementation involves the installation of the system, the dentist and the staff training, going through a mock go live of the system, and then doing the pilot testing. So it's kind of a phased process, and again, the vendor that you, the product that you choose and your trainers, they will walk you through all of this as well, but these are things you need to be aware of to make sure that these things are happening as they are supposed to. The EHR implementation plan and schedule, which is developed during the planning phase, should be followed and executed during this phase. You'll be doing your, you'll be executing your chart abstraction plan and other data migration plans at this particular point, and again with your vendor. You'll be executing your EHR implementation training plan that includes your specific practice goals and needs. And you'll be addressing any privacy and security risk management for your mitigation plan at this particular phase. And again, a very heavy involvement from your vendor at this particular point. That's why this particular section is a little bit lighter in terms of information, because you need to know the high-level things and the key pieces that are going to be happening during the implementation and the training. But this will be guided very heavily by your vendor. This is where you'll be asking a lot of questions. You'll be getting more hands-on with it and getting all those kinks worked out that may need to be smoothed out, so that everyone is able to use the system and get trained and get off and running with your EHR. Okay, so once you have your EHR in place, you can then begin looking at, are you meaningfully using your EHR? I want to spend just a couple of slides here for those who might not be fully aware of some of the details as far as the Meaningful Use Program. The Medicare and Medicaid EHR incentive programs provide a financial incentive for achieving meaningful use. It is meaningful use is the use of a certified, so there's that word again, a certified EHR technology to achieve health and efficiency goals. And meaningful use has core and menu objectives for eligible professionals, and of course, dentists are part of the eligible professionals group of providers, as outlined by CMS. They are intended to set a baseline for electronic data capture and information sharing. The MU objectives are grouped into 5 patient-driven domains that relate to health outcomes, policy priorities. Each core and menu objective is aligned to one of the following domains. So these 5 domains are what CMS set forth in terms of the backbone for meaningful use. So improve quality, safety, and efficiency, engage patients and families, improve care coordination, improve public and population health, and ensure privacy and security for personal health information. So in terms of the Medicare and Medicaid incentive programs, most dentists who are looking to attest for meaningful use and to receive those incentive payments, most often are looking at the Medicaid side of the incentive program, because that's going to provide the typically the most incentive dollars to you. The Medicare side incentive dollars are based on your Medicare Part B claims and reimbursements, and not a lot of dentists do a lot with the Medicare Part B, and that's on a scale in terms of what your incentive payments would be. So that's why most dentists look at the Medicaid side of the incentive program. So take a moment. I have the link at the resources slide that gives you some information about, or sends you to the Iowa Medicaid EHR Incentive Program website. There are eligibility criteria to be able to take part in that. What you need to keep in mind, and I really want to stress in terms of the Medicaid, Iowa Medicaid Incentive Program, is this is the last year to initiate into that program for to be involved and to receive incentive dollars. 2016 is the last year to initiate into the program. So if you haven't already done so in terms of looking at that to see if you're eligible and to get that process started, please do so now. We are running out of time. Providers are running out of time in terms of that. As 2016, you know, we've moved into the second half of the year now. Please do contact me with questions about that, and I can point you in the right direction. Just wanted to make sure folks were aware, though, 2016 is the last year for that, to initiate into the program. Okay, step number 6, continue quality improvement. This final phase refers to reassessing what you have learned from training and your everyday use of the system. It emphasizes continuous evaluation of your practice's goals and needs post-EHR implementation to continue improving your workflows that achieve your goals and needs while leveraging the functionality of the EHR. So were the goals and needs met? Do workflow processes need to be reevaluated? Is additional training required? So what you're looking at here is once you've got your system in place and your dentist and your staff are using it, it's important to go back and have time to reevaluate. They'll have time for staff and dentists to give their feedback on what isn't working well, to do some of that fine-tuning, to work some more with your vendor to say, hey, we've been using the system for a couple of months now, and this particular piece isn't working well for us, or this workflow isn't efficient for us. Is there, what are the different options that we have in terms of going about that differently with our system? So you want people to be comfortable with the system. You want folks to be able to make sure that the system is working efficiently for their jobs. Number 4, are you capturing the required data elements needed for internal clinical priorities as well as for reportable quality measures? Number 5, do staff roles and responsibilities need adjustments? Is the technology in the appropriate location? So even in terms of your physical hardware, is everything in the most appropriate place in terms of laptops or tablets or PCs? Where are all those things located? Are they in the best spots now that you're using the system, or do we need to reconsider what we originally thought and maybe move some of those pieces to more applicable areas? Is the technology reliable? Is the technology fast enough? And is additional hardware needed? These are all things that you sometimes can't get a really good sense of until it's installed in your practice and everyone's using it. Again, the fine-tuning. So evaluate your implementation. A post-EHR implementation evaluation will help shape both the practice and its evolution. So have a chance for folks to give, your staff to give feedback. Often what happens during the implementation phase is very different from what was planned. So, you know, there might be bumps along the road. There also might be some silver linings that you hadn't expected. So there might be certain elements that end up going a lot smoother than what you might originally have figured. Regularly evaluate your processes to ensure that the practice is functioning efficiently to ensure staff and patient satisfaction. Very important. There have been some lessons learned from the field. Again, EHRs have been around for quite some time now, very strong in the last decade or so across primary care. And so there's some lessons learned that have come forth over the last years in terms of straight from the field. So number 1, rapid transition from paper charts to EHRs helps ensure success. It has been proven that practices that kind of take a slow approach to the implementation, so they get the system installed, but some providers start using it right away. Others take a slower approach and just kind of keep wanting to use paper and part electronic, and they just kind of very, very slowly kind of rip that Band-Aid off. That ends up shooting themselves in the foot in the long run. So that rapid transition from paper to EHRs really, in terms of lessons from the field, the way to go. Lesson 2, conduct chart abstraction before go live. So again, determine what those key pieces are that need to come from your paper charts, get them in the system before you have officially gone live for everyone so that they can pull the patient up, they know who the patient is, and some of that key information is in there. Then as the dentist and staff immediately start seeing those people, there's some information in there to go from. Lesson 3, cut back on patient load during your go-live period. This is very important. Yes, it's going to be a little challenging for those days or potentially weeks, depending on your particular office. in terms of cutting back on patient load, but it's important. It's going to take your staff and your dentist a little longer to get through a patient visit because you're putting information into the system, you're figuring out those new workflows. So do make that sacrifice to cut back somewhat on your patient load during your go-live period. And lesson 4, make training a priority. So important, it will cut down on the frustration of staff. If they feel properly trained, you may have, there typically are different packages involved with vendors in terms of how much training that you want or need. Try, if you can, not to kind of skimp too much on that training piece because, again, in the long run, it's going to make for a much easier transition for your staff if they feel like they've gotten some very solid training and can go ahead and get started and feel comfortable and confident with what they're doing. In terms of some helpful resources, I've got 3 of the main ones here. The healthit.gov website, again, very, very good information out there. I provided the link. There's the one of the main tabs is for providers and professionals. There's a lot of good information there in terms of EHR selection, in terms of meaningful use, in terms of interoperability and HIE for providers. Please go and utilize that website. There's some really good stuff there. There's a lot of, there's some really good success stories. If you want to read through some of those are directly from providers around the country who have gone through this process. Some very good success stories out there too. So a wealth of information on the healthit.gov website. The second one is the Iowa DHS Health IT and EHR website. I mentioned this one a few moments ago. Please go out there. Excellent, excellent stuff that has been provided to you out there in terms of what you need to do to get involved in that EHR incentive program. Again, Iowa Medicaid last year to initiate into that program. There's some excellent tools out there in terms of figuring out if you're, if you as an individual dentist or as a practice are eligible to participate in that program and receive those incentive dollars, and contact information for the folks at the EHR program over there. Carrie Ortega is one of the main contacts over there. She is great at answering all of your questions and helping set you on the right path to getting you those incentive dollars and getting registered if you are eligible for that program. So again, go to that website, a lot of good information to help guide you through that process. And lastly, the CMS EHR Incentive Programs and Meaningful Use website. If you need to know more about the meaningful use measures, if you need to know more about the criteria and get involved in that program, that's the link there is there as well. So please go and check out all of that. Here is my direct contact information. Please do, I can't stress to you enough, if you have questions regarding any of this process, where to go for specific information on what I've talked about today, please feel free to reach out to me either by email or phone, and I'm happy to help you through this particular process in any way that I can. So that concludes the presentation part. I'm going to go ahead and open up the phone lines for anyone that might have questions. Let me do that now. Hopefully hit all the right buttons here. Okay,
the leader has unmuted your line.
I just unmuted all of the lines, so if anyone has any questions, feel free.
One slide. I didn't get all of the website for CMS.
Oh, sure. And yes, I'm glad you brought that up because I wanted to mention that if you go to the Iowa DHS website, so that second one that's listed there, we will be posting these slides out there for you. And we've also recorded today's session. And so once we get that recording downloaded and posted, you can access today's session to re-listen to it. If there are other staff or dentists in your practice that were not able to be on this live presentation today, but you think would be valuable for them to listen as well, please access that recording. It will be posted on this slide on the website as well. Again, it's the second one, the Iowa DHS HIT site, and if you scroll down towards the bottom of that page, there is a section for dentists, and that's where the recording and the slides will be made available to you. And again, if in a couple days or a week or so passes and you can't find it or anything, or just please give me a call or send me an email, and I can make sure that I can get you pointed in the right direction for that. So we want to make sure that you all are going to be able to access the slides for your reference, and as well as the recording. So thank you. Any other particular questions I can help with? There's a lot of information. We know a lot of the information may seem overwhelming to some, but we wanted to make sure that this presentation provided you with some really good detail that you could wrap your hands around to get your process started, or you might be in the middle of your process and realize that there are some things that you haven't yet taken into consideration that hopefully today's presentation brought to light for you. So again, it's a lot to digest, but hopefully helpful to you as you move forward.
Marlene, we are in the process of going to no charts. However,
okay.
All our charts down here, and we take it back, Dr. gets them, and what we do with the new patients is we just scan it into the system and then throw it away, but with the old stuff, it's still going back into the chart and back into the walls.
Okay. So I apologize. Our connection here is cutting in and out just a little bit. Do you have an EHR system in place yet? Okay. So you're finding you're still kind of going back and forth with the paper to find information.
Give up the paper.
Okay. Theoretically, from all the experience we've had with other clinics, theoretically, over time, that should start to diminish, because as patients continue to come in for appointments over time, more and more of that information should be going, into the electronic system.
Okay.
So I would say so long as your dentists are not currently and continuing to jot notes in a paper chart or do anything, in a current way with paper, everything current should be going into the electronic system. It should only be historical information that they're needing to get those charts in and out for.
Yeah,
so
he's doing everything current.
Okay, that's good. Then okay.
If we have them, he doesn't want to give them up. I think he'll be taken under the stores.
Okay. And that's not entirely uncommon. There's a security that's involved there with knowing that, okay, if my paper charts are out on the file, I can, they're there, they're physical, I can, get information from them. But again, it sounds like that your particular provider is just, a little bit more attached to those charts than maybe others are. But again, over time, you should see that, slowly start to dwindle, where it should come to a point in time where he shouldn't really need much of anything anymore from them. So I hope that you're starting a little bit to see that, or will start to see that.
Well, I had one the other day that I needed to go back and get an extra from 2009.
Okay. And do you envision that you will eventually have either on-site or off-site storage for your paper charts?
Yes, we have on-site in the...
Okay. Okay. Well, I would say so long as they're, readily available, at some point in time, when you start using them less and less, you probably want to get them out of your way, so to speak, in your normal work areas. And a little bit could help too, we've heard and seen, in terms of a little bit of that out of sight, out of mind. He might be less inclined to want to jump back into those as much if they're, upstairs in banker's boxes filed away, that type of thing. So,
how much information from the old chart should be put into the new system?
That's a very, very good question. Typically what folks do, obviously you want, and your vendor can typically help you with this too, you want all your demographic information, as much health history as you can in terms of family history stuff, all your basic stuff that is normal. But what you want to do in terms of past visits, anywhere, at minimum a year. Fairly common is 2 years. It depends on, you're going to have, it's kind of all over, because you're going to have some patients who really only ever see you twice a year, maybe, on average. They come in for their every 6 months. So not a lot to do with some of those. You have your other more complex patients who you're seeing for a variety of things, who you see very, very often, and their paper chart has a lot more information in it. So for some of those folks, if you need to sort of tier some of those folks in terms of just, what I want to say, preventive folks versus your more complex patients, you might just want, you might need a year of your complex patients because their stuff is kind of ongoing. You want to have those discussions as a team on what makes sense. But again, you might have your more standard folks a little less that you're doing, or more, depending if you decide that's what you want to do. Your more complex patients, handle in a little bit different way. But at minimum, a year for folks.
Okay.
But then again, we see this we talk to some people who they only want the very basic demographics. They want all the history, any meds they're on, those types of things. And the only thing they want in there is the patient's very last time they came into that office. They don't want all that other stuff. You have other practices who, again, are a little bit more, hold dear to their heart all that information, who want more abstracted and pulled over. So it's kind of a preference type thing for each individual practice. So, and it can be a little hard to navigate if you have some staff and dentists that tend more towards the less is more approach, and others who want lots and lots of stuff pulled in. So you're going to have to kind of work that out as a group.
Right. Because most everything we're doing now is scanning. We're making them fill out new paperwork and scanning and all the new stuff.
Okay. Sure.
Okay.
You're on the right track. But yeah, some of these things are, you kind of have to sit down and hash it out together as a group to figure out what's everybody going to be happy with.
Right. Okay.
Well, I think you were straight up at 1 o'clock, so I will sign off the call now. But again, here, I'll pop my number back and my email up there one more time for folks. Thank you for joining us today, and I look forward to hearing from many of you with any follow-up that I can help with. So thanks again, and have a great afternoon.
Thank you, Marlene.
You're very welcome.